Good evening, everyone. I want to start by making you a promise tonight. This is not a sales pitch. I'm not here to push you towards anything. What I'm here to do, and what I take seriously every time I stand in front of a room like this, is to make sure that you leave tonight understanding something that most Americans never fully understand until they get a bill they didn't see coming. Whether you're turning 65 soon, whether you've been on Medicare for years, whether you have both Medicare and Medicaid, or whether you're on Medicare because of a disability, tonight is built for every single person at these tables. Tonight is education first, full stop. By the time we're done, you will know what you have, what it costs, and where the gaps are, and then you decide what to do with that information. Fair enough? So before we dive in, I want to take a quick look around the room because Medicare is not one size fits all, and your situation determines what applies to you. Some of you are turning 65 soon. You may not even have Medicare yet, and honestly, you're not sure when to start. That's okay. We're going to walk you through it step by step. Some of you are already on original Medicare. You have Part A and B, but you may have gaps in your coverage that you do not know about yet. Some of you are on Medicare Advantage plan. You may love it, or you may have questions about it. Either way, tonight you're going to understand exactly what you have. Some of you have both Medicare and Medicaid, what we call dual eligible. The government covers a lot for you, but there are still things to know. And some of you may be on Medicare because of a disability. You're under 65, different rules apply to you, and we'll touch on that. Whether you are in that list, wherever you are in that list, tonight covers all of you. So let's get into it. Now I want to do something different tonight. Before I throw a single number at you, I want you, well, I have some papers going out to you. If you did not get those papers to follow along with, I want you to draw a line down the middle of your note card. Now on the left side, if you don't have the sheet that I provided for you, I want you to write the car. On the right side, I want you to write the bus. The left side, the car, that's a original Medicare. The right side, the bus, that's Medicare Advantage. Now we're going to fill in both columns together tonight, and when we're done, you're going to decide which one fits your life. I'm not going to decide that for you. Nobody in this room can make that choice for you. But I'm going to make sure you have everything you need to make it confidently. Now let's start on the left side, the car. Here's what I want you to understand about the car from the jump. The car is yours. You own it. Nobody tells you where to drive. Nobody gives you a list of approved roads. Nobody makes you ask permission before you can see a specialist. With the car, you can walk into any doctor's office in America that accepts Medicare. and they have to take you. You don't need a referral. You don't need to call an 800 number and wait for approval. You just go. You travel to Florida in the winter, your Medicare works in Florida. You go see your grandkids in Texas, it works in Texas. You have a medical emergency in Ohio, it works in Ohio. The car goes everywhere. Freedom is the product. Now, the car has 4 parts. Think of it like this. The car has an engine, a steering wheel, a gas tank, and insurance on the car itself. Let's open the hood. Part A is the engine. That's your hospital coverage. It handles the big stuff. Part B is the steering wheel. That's your doctor and outpatient coverage. It keeps you moving day to day. Part D is the gas. That's your prescription drug coverage. Without it, the car might still run, but not for long. And Medigap, or the Medicare Supplement, that is the insurance policy on the car itself. Because even your own car can get into an accident. And in Medicare, that accident is called 20%. That Part B doesn't cover, with no ceiling on what you can owe. So let's go through each one. Part A is your hospital insurance. It covers inpatient hospital stays, skilled nursing facility care, some home health services, and hospice. Here's the good news. For most of you, Part A is no cost. If you and your spouse worked and paid Medicare taxes for at least 10 years, that's 40 quarters. Your Part A premium is $0 a month. You earned it. Now, if you didn't quite hit 40 quarters, you can still buy into Part A. If you have between 30 and 39 quarters, you pay $311 a month in 2026. Fewer than 30 quarters, you pay $565 a month. But your costs don't stop at the premium. With Part A, there is a deductible of $1,736. And here's the important part. That is not a per year deductible. That is a per benefit period deductible. Meaning, if you go into the hospital, get discharged, and then go back in 60 days, you could hit that deductible again. And if you end up in a skilled nursing facility, a rehab center after hospital stay, days 1 through 20 are covered. Days 21 through 100, you pay $217 a day out of pocket. After day 100, you're on your own. Part A is powerful, but it's not complete on its own. Now remember, guys, all of these figures reflect 2026. They're subject to change year to year. Now Part B is your medical insurance, your doctor's visits, your outpatient care, lab work, imaging, durable medical equipment, and certain home health and preventative services. In 2026, the standard Part B premium is $202.90 per month. For most people, that comes right out of your Social Security check. You probably see it on there already. Now, there are people in this room who may pay more for that. If your income is above a certain threshold, Medicare charges what's called IRMA, an income-related surcharge. That can push your Part B premium from $202.90 all the way up to $690 a month. If that affects you, we'll talk about that one-on-one. After your annual deductible of $283, you pay 20% of every Medicare approved service. Every doctor visit, every outpatient procedure, every piece of equipment. 20% sounds small, and when it's $200 doctor's visit, it is small. But here's what nobody tells you. There is no ceiling on what that 20% can add up to. A $500,000 surgery, 20% of that is $100,000 out of your pocket with nothing to stop it. That is the gap, and that is exactly why the supplement, the insurance on the car, that's why it exists. Again, this is based on 2026. Every year, things are subject to change. Pardon me, I missed that slide, guys. But let us continue here. Part D is your prescription drug coverage. On its own, it's a separate plan you pick up from a private insurance company that works alongside your original Medicare. And guys, you can, if you see this as a video, you can stop and go back and look at that if you need to. But again, my apologies. I will stay on task. So I'm going to take it from the top again on this slide, okay? Part D is your prescription drug coverage. On its own, it's a separate plan you pick up from a private insurance company that works alongside your original Medicare. In 2026, the average standalone Part D plan runs about $34.50 a month. Some are lower, some are higher. The maximum deductible on a plan can change that can charge you is $615 a year, though many plans have lower deductibles or none at all. Here's a significant change that already took effect. The donut hole is gone. As of 2025, there's no more coverage gap in Part D, and your out-of-pocket drug costs are now capped at $2,100 a year. Once you hit that number, your drugs are covered for the rest of the year. Insulin, it's capped at $35 a month. Recommended vaccines, $0. Now, here's the thing I need every person in this room to hear. Do not skip Part D just because you don't take medications right now. Please don't skip it. If you go without Part D when you first become eligible and you don't have other credible drug coverage, Medicare charges you a late enrollment penalty, and that penalty doesn't go away. It stays with you permanently every single month for as long as you have drug coverage. And one more thing, a few dollars saved today could cost you hundreds more every year for the rest of your life. Don't make that trade. Okay? Now, remember that unlimited 20% I just talked about? This is the answer to it. A Medicare Supplement, also called Medigap, is a private insurance policy that fills in the gaps of original Medicare and what it leaves behind. You pay a monthly premium, and in exchange, your out-of-pocket exposure becomes almost nothing. The most popular plan for new Medicare enrollees right now is Plan G, like girl. And there's a reason for that. Plan G covers your Part A hospital deductible. That's $1,736 we talked about. It covers the skilled nursing facility coinsurance. It covers 20% that Part B doesn't pay on every service, every time. It even covers emergency care if you're traveling outside of the United States. The only thing Plan G does not cover is the Part B deductible, which in 2026 is $283 for the whole year. That's it. That is your total out-of-pocket medical exposure for the year. $283. That's what stands between you and everything Medicare approves. It does not cover prescription drugs. You still need Part D for that. It does not cover routine dental, vision, and hearing. And it does not cover long-term custodial care. But for your doctor's visits, your hospital stays, your outpatient procedures, once Plan G is in place, the financial exposure is essentially gone. Now let's talk real numbers, because this is usually where people start to hesitate. A Plan G supplement for a 65-year-old non-smoker in 2026 typically runs between $100 and $200 a month, depending on your age, your gender, where you live, and which carrier you choose. When you add that to your Part B premium of $202.90 and a Part D drug plan somewhere between $20 and $60 a month, your total monthly healthcare cost is somewhere in the neighborhood of $325 to $465 a month. Now, I want you to sit with your number for a second, because most people hear that and think, that's a lot. But here's the other side of that coin. After you pay those premiums, your exposure for actual medical care is $283 for the entire year. No surprise bills, no prior authorizations for most services, no network to stay inside, no copays, stacking up every time you go to the doctor. You hand them your Medicare card and your supplement card, and you walk out. That's the car fully assembled. And once people see it that way, most of them don't want to get off of it. Now let me give you both sides of the car, the real pros and the real cons. The pros: You can see any doctor or hospital in America that accepts Medicare, no network, no referrals for most care. Your coverage works the same in every state. Your out-of-pocket costs become extremely predictable once the supplement is in place, and your coverage doesn't renegotiate every January 1st. From where I sit as an agent, clients on the car are stable. They rarely call with emergencies. They're not dealing with prior authorization denials or network charges. The relationship is clean. The cons? I have to be honest with you. The monthly premium is higher than what you'd pay on the bus, especially up front. There are no built-in extras. No dental, no vision, no hearing, no over-the-counter benefits. You have to buy those separately. And the one issue I run into most often with car clients, affordability. If someone's living on a fixed income and $400 a month in premiums become a real strain, we have a conversation about it. But here's what I need you to know. If affordability ever becomes the issue, you can switch from the car to the bus during the annual election period. That door is always open. Going the other direction, that's a different story, and we'll get into that. Now let's go to the right side of your card or your sheet and talk about the bus. Medicare Advantage, also known as Part C, is a different way to receive Medicare benefits. Instead of going directly through the federal government like original Medicare does, you enroll in a plan offered by a private insurance company that Medicare has approved. The bus is real. The bus works. For the right person in the right situation, the bus is a perfectly good vehicle. I want you to hear me say that. But you need to understand the rules of the bus before you get on. Because once you're on it, you play by its schedule, not yours. Medicare Advantage plans are required by law to cover everything original Medicare covers, but they do it differently. Through networks, through copays, through prior authorizations, and they often add benefits that original Medicare simply doesn't have. Let's break it down. So here's one of the biggest reasons people choose Medicare Advantage: the extras. Many Advantage plans include dental coverage, not just emergencies, routine cleanings, x-rays, sometimes major dental work. Original Medicare covers almost none of that. Vision, we're talking eye exams, glasses, contacts. Hearing, we're talking exams, hearing aids. These are not covered by original Medicare. What about over-the-counter benefit cards? Some plans give you $25 to $150 or more every quarter to spend on vitamins, pain relievers, first aid supplies, and more at participating stores. What about food and grocery allowance? Select plans provide monthly credits you can use toward healthy groceries. What about utility assistance? Yes, some plans help with electricity or gas bills, especially for qualifying chronic condition members. They also offer in some plans transportation to medical appointments. If getting to the doctor is a challenge, some plans include rides. Some plans include fitness memberships. We're talking gym access, silver sneakers, wellness programs, and one more, Part B premium giveback. Some plans actually credit a portion of your $202.90 Part B premium back to your Social Security check every month. These are real benefits, real dollars. I'm not going to minimize them. Again, based on zip code and year, things change. Now let's talk about what the bus actually cost, because the premium number doesn't tell the whole story. The monthly premium for many Medicare Advantage plans is $0. Beyond the Part B premium you're already paying, some plans don't charge you a single additional dollar per month. That's attractive. I understand that. But here's how the bus makes its money. You pay when you use it. The primary care visit might run you $0 to $20. A specialist visit, $20 to $50. An emergency room visit, $90 to $120. Outpatient surgery, $150 to $500. And hospital stays, this is where it gets important. In 2026, many plans charge you a daily copay for hospital stays. Days 1 through 5 might be $250 to $400 a day out of pocket before your plan kicks in more fully. The good news, Medicare Advantage does have an annual out-of-pocket maximum. In 2026, that cap is $9,250. Once you hit that number in a year, your in-network care is covered. The question is, are you okay potentially paying toward $9,250 before the protection kicks in? For some people, the answer is yes. For others, especially those with frequent medical needs, the math starts to flip. Now, I want to spend a minute on something most people don't find out about until they're sitting in a doctor's office and their plan is pushing back. Prior authorization. On Medicare Advantage, many procedures, certain surgeries, specialist referrals, specific medications require the insurance company to approve before you can have them. The doctor might say you need something. The plan might say, not yet, or not at all. If you're in an HMO plan, the most common type of Advantage plan, you typically need a referral from your primary care doctor before you can see a specialist. The card doesn't require that. The bus does. And here's the one that catches people off guard. Your network can change on January the 1st. The doctor you saw all year might not be in your plan's network next year. And if they're out of network, you either pay more or you find a new doctor. Think about public transportation for a second. You've taken the bus, you know how it works. You have to be at the right stop at the right time, going in the right direction. The bus doesn't reroute for you. If you miss your stop, you start over. That's what prior authorization and network restrictions feel like. And for people who are delaying or dealing with a serious health issue, that friction can be more than inconvenient. It can delay care. Now let me give you both sides of the bus fairly. The pros. The monthly premium is often $0. You have an out-of-pocket maximum that protects you from catastrophic cost. You get extra benefits that original Medicare doesn't include, such as dental, vision, hearing, over-the-counter, food, gym, transportation, and in some cases a Part B give back. And your prescription drug costs are capped at $2,100 a year. For a healthy person on a tight budget who stays close to home and rarely use medical care, the bus can be a very smart choice. The cons: you are in a network. You need referrals in most plans. Procedures require prior authorization. Your plan benefits and network can change every January 1st. Copays stack up with frequent use. And you could find yourself spending towards that $9,250 out-of-pocket maximum if you have a significant health event. And there's one more con that deserves its own slide, rather, because it may be most important thing I say tonight. I want you to pay attention to this. I want you to listen closely right now. Getting on the bus is easy. During the annual election period, October the 15th through December the 7th, you can move from original Medicare to Medicare Advantage plan with no health questions. They have to take you. Getting off the bus and back to original Medicare, that part is easy too. You can do it during those same enrollment windows. But here's the part nobody tells you. If you want to come back to original Medicare and get a Medigap supplement to cover that 20%, in most states, the supplement company can ask about your health. They can look at your medical history, and if you've had a stroke, been diagnosed with diabetes, had a heart attack, have COPD, they can deny your application, or they can charge you significantly more. 3 states, Connecticut, Massachusetts, and New York, do not allow carriers to deny you regardless of health. Everywhere else, the protection is not guaranteed once your initial enrollment window closes. So here's what this means practically. The time to choose the car with full protection is when you are healthy enough to qualify for it. If you're 65, just enrolling, and in reasonably good health, that is your window. That is your moment. If you wait until something happens and then try to come back to original Medicare with a supplement, the door may be locked. So switching from the car to the bus is always possible. Switching from the bus to the car with full supplement protection is not guaranteed. Now let me walk you through the enrollment windows because the timing matters, and missing it can cost you. First, before you can get any supplemental plan or Medicare Advantage plan, you must have both Parts A and Part B active. That's the foundation. Everything else builds on top of it. If you're turning 65, you have a 7-month initial election period called IEP. That's 3 months before your birthday month itself, and 3 months after. That's when you enroll in Parts A and B. Once your Part B is effective, your Medigap open enrollment period begins. That's a 6-month window. And during that window, every insurance company is required to accept you. No health questions, no denials, no higher premiums because of a pre-existing condition. This is your golden ticket. Miss that window, and in most states, you lose those guaranteed protections. Carriers can underwrite you, and if your health has changed, they can close the door. If you're already on Medicare, the annual election period, known as AEP, runs October the 15th through December the 7th every year. That's when you can switch between original Medicare and Medicare Advantage, change Advantage plans, or adjust your Part D coverage Changes take effect January 1. The Medicare Advantage open enrollment period runs January 1st through March 31st if you're on Advantage plan and want to make a change. That's your window. Special enrollment periods exist for qualifying life events, moving, losing other coverage, or other circumstances. If you think you may qualify for one, we'll talk about that individually. Now, I want to take a moment for some of you specifically, because your situation is different and you deserve to have it addressed directly. If you have both Medicare and Medicaid, you are what's called dual eligible. Medicaid acts as a secondary payer for you, picking up many of the costs Medicare doesn't cover. You may also qualify for a DSNP, also called Disability Special Needs Program or Special Needs Plan, which is a Medicare Advantage plan built specifically for people in your situation. Other, often zero premium, coordinated care, and enhanced benefits. If you have a chronic condition, such as heart failure, diabetes, COPD, you may qualify for a CSNP, which is a chronic special needs plan. These are Advantage plans designed around managing your specific condition. Everything is coordinated in one place. If you're under 65 and on Medicare because of a disability, I want to be specific, especially clear with you. In most states, Medigap carriers can use medical underwriting on you. Your guaranteed issue rights on a supplement typically don't kick in fully until you turn 65. Know your state-specific rules. If you're in Virginia, Maryland, or one of the other licensed states, we'll walk through exactly what applies to you. Your situation is specific. Get a personalized review, not a general answer. I want to give you a quick reference of all the key 2026 numbers so you have them in one place. Part A, free for most people, but the hospital deductible per benefit period is $1,736. Skilled nursing from days 21 to 100 costs $217 a day. Part B, $202.90 a month standard. $283 annual deductible. After that, 20% with no ceiling unless you have a supplement. Medicare Advantage. The out-of-pocket maximum is capped at $9,250 this year. Part D. Average standalone plan around $34.50 a month. Maximum deductible is $615. Out-of-pocket drug costs capped at $2,100. Medigap Plan G typically cost $100 to $200 a month for a 65-year-old. Your Medigap enrollment window is 6 months from your Part B effective date. Write these down. Sorry about that. Take a photo of the slide. These are your numbers. And again, this is based on 2026. Every year there's going to be some changes. Be aware. Now look down at your notes. On the left, the car, original Medicare, Part A, Part B, Part D, and a Medigap supplement. Freedom, flexibility, predictable cost. Works anywhere in America. Your out-of-pocket exposure is essentially capped at one small deductible per year. On the right, the bus, Medicare Advantage, often $0 premium, extra benefits, dental, vision, hearing, over-the-counter, food, gym, transportation, an out-of-pocket maximum that protects you from catastrophic cost, all in one convenient plan. Both vehicles are real. Both serve real people. Neither one is wrong. The best plan is the one that fits your health, your budget, and your life. Not your neighbors, not your sisters, not whoever told you what to get. Some of you already know which one you are. You've known since we started filling in that note card. Some of you have more questions, and that's exactly what the next step is for. So let me ask you directly, and I mean this genuinely. Are you a car person or you're a bus person? Tonight you got something most people never get. A clear, honest look at how Medicare actually works before something goes wrong. But education alone doesn't protect you. The next step is sitting down together, one-on-one. We typically can do that right from the confines of your own home, where we can do a video conference, or we can do it over the phone, either way. So I can look at your specific situation. What do you currently have? Is there a gap? Are you paying for something you don't need? Are you missing something that could cost you significantly down the road? There is no cost for that conversation. There is no obligation. My compensation comes from the carriers, not from you. My job is to find you the best fit, not the most expensive one. Please fill out the card at your table before you leave tonight. If you're watching this on video, there is a link to my calendar for you to schedule a time that's conducive for you. I'm happy to help you. Put down the best way to reach you and a couple of times that work for you. My team will be in touch with you and schedule your personal Medicare review. Now, a quick word about who we are. Buckeye Financial is an independent insurance and retirement planning agency. We are not captive to any single carrier. We shop the entire market on your behalf. And that matters because when I make a recommendation, it's based on what's actually best for you, not what earns me the highest commission. We specialize in Medicare, retirement income protection, annuities, life insurance, and long-term care planning. Whether you're building your retirement or protecting what you've already built, that is our lane. I thank you guys for being here tonight. Thank you for trusting me with your time, and I look forward to serving you.